Hello, my name is Niall McKay and welcome to Living with PSC, a podcast about the rare disease of primary sclerosing cholangitis. Now, PSC causes the bile ducts inside and outside the liver to become scarred, narrowed and eventually blocked, and leads to liver cirrhosis. In this podcast, we aim to dispel some of the myths about the disease. Today we're talking to Dr. Kidist Yimam, who is a transplant hepatologist. Welcome, Dr. Yimam.
I am the medical director of our autoimmune liver disease program here at California Pacific Medical Center in San Francisco. Mostly PSC, PBC in autoimmune hepatitis. And, for many reasons, I've been touched by patients with PSC, and that's actually the reason I even formed and dedicated what I do.
One of the things that seems to be a misconception about the disease is that it is more prevalent in white males from Northern European background.
There is that misconception or misunderstanding that PSC only affects, Caucasians of Northern European descent. But that, I think the general provider community probably still thinks that way. It may not be the case in terms of the hepatology community. And so, yes, most of the studies describing the natural histories and outcomes of patients in PSC were done from patients from the Scandinavian region, Northern European descent. So it is true that we don't understand, properly the natural history outcomes, how is the disease manifesting, etc., in a very diverse patient population, for example, from North America, Africa. Like I said, I'm Ethiopian. I go often to give liver conferences and teaching and etc. I was touched that there are people with PSC in Africa too. And so we haven't done the work. It's true. We can't say that it only affects Caucasians. It is prevalent in other patient population. We do need to do the work. And that's one of the reasons that we found the formation of the Northern America Autoimmune Liver Disease Consortium was driven to contribute to this data. That's the CALID network, trying to understand the natural history in a diverse patient population more. And I think one of the studies that was presented, that I presented at the PSC Partners Conference this June, like you stated, we looked at 13, large liver centers across North America. We also included Calgary. They're part of our network. And we were able to show that, in this simple cross-sectional study, the proportion of Black patients affected by PSC, it seems to be parallel to, the proportion of Blacks living in the metropolitan area. In fact, for example, Henry Ford, they had 25% of their patients affected that had PSC were actually African American. So it is there.
Do you think there's a patient bias where patients are falling through the cracks simply because of where they live or the color of their skin?
There seems to be a slight delay in recognizing the disease because, people, providers in general may not think PSC is affecting them, they're looking at alcohol, other causes, fatty liver disease, so the pattern is actually different, much different, how the patients present. Till this late stage, I have, come across few patients that, unfortunately, a couple of patients that presented with cholangiocarcinoma, didn't live, because of the delay in diagnosis and they've been tossed around. So, yeah, certainly there is a provider bias, access to care, your educational status and your curiosity in pursuing and pushing the system to get a diagnosis. So, yes, we see that, and that's the reason we're doing this effort with PSC Partners is to increase awareness.
It's interesting because I think as well, it's an ideal disease for people to ignore until the late stages. Like people might put up with a lot of or might even attribute a lot of their symptoms to other things, because the symptoms are very almost non-specific.
If you're not getting regular medical care, right, that's appropriate for age and are in tune to your body, like you stated, the symptoms could be non-specific to none. And by the time patients are itching and having jaundice, and, that seems to be a bit advanced. And, again, that's a good point that you brought up about PSC. It doesn't present with symptoms early on, and they tend to be non-specific unless you're really getting your regular medical care and, routine labs, even just to maintain your health so that it can be picked up asymptomatically at early stage. I think those are the rare occasions, right? Patients having asymptomatic elevation in liver enzymes. Most patients present with symptoms, and that tends to be a bit advanced. If you don't have the means and the resources and the education, you may not be able to do that. So that, right, by default will lead to, right, affecting people that are underserved, minority, where they may not be represented in the general population a bit more, or those with low socioeconomic status, less access to care, those living in rural area. So in general, underserved and disadvantaged patients could be affected even a bit more.
Some people think that PSC has a genetic component, and perhaps it does. But if it's presenting in multiple groups, in multiple ethnicities, then perhaps the genetic component side of it might be either overestimated or has perhaps an environmental component.
I think it's important that we make an effort, right, to sample a diverse patient group so that we can study those in a more detailed manner, so that you're comparing it with different ethnic and racial background. I think the PSC partners efforts, the different consortiums, particularly the North America Autoimmune Liver Disease Consortium, is making an effort to collect, right, a diverse set of data to also study genetics. I think those are some of the things that we need to work. We need to understand, right, what's really impacting, what's really causing this poor outcome, right? It is certainly multifactorial, understanding the genetics of the disease predisposing factors or things that could predict prognosis would be very important. So we need to do the work. We need to do the work in a more diverse patient sample, understanding exposure, right? Environmental factors like where do you live? Are there any toxins or pathogens, etc., that would predispose you? Certainly, the socioeconomic part also needs to be teased out more.
Are there any southern-based PSC clinics? Is there a PSC clinic in Africa, for example, or in South America?
There is a program called a Connect program, which is a conference that ASLD collaborates with Africa or different regions in the world, and they do a collaborative conference, which we had one this year in 2022. And the conference was held in Addis Ababa, Ethiopia, and we had speakers from all over Africa that came in. It was a good platform to get to know, right, how our liver disease is affecting our African patient population and whatnot, and understanding their experience. And I was very surprised to learn that one of the number one cause of end-stage liver disease and liver transplant in South Africa is actually PSC.
Wow.
They presented their data, and that's the disease. It's the leading cause of liver transplant in Africa, and it's not just affecting, Caucasian South African, is affecting, Black South Africans as well. So we talked about we're ASLD has formed now a regional advisory council by collaborating with different hepatology leaders from different parts of the continent and Africa. And so one of the things we talked about is collaborating in maybe, given my interest in PSC and autoimmune liver diseases, to think about doing a study, a natural history study by sampling different health liver centers and understand the natural history there. So yes, the answer is yes, it does affect patients in Africa as well, and we do need to expand, right, our understanding of how PSC is affecting not only just in the northern America, but extending it to Africa in different regions. We have, right, many immigrants that are of African origin that we're taking care of. I have few that actually do have PSC.
The PSC Partners Patient Registry, I think, where they are trying to collect information not only but from a diverse background as well. I mean, I think also one of the things that people miss, perhaps, is that collecting a diverse range of patients also helps in the study as well.
That's one of the awareness, right, we should advocate for, is including diverse patients with PSC. Make as much effort as possible to do so in, any natural history study, and so that we can understand what you were asking earlier. How is the genetics, right, playing a role, or are there other factors, socioeconomic factors, that are affecting care? So including, make a very active effort to be inclusive in natural history studies, clinical trials, right? Support them by, right, encouraging engagement at PSC partners so that they can be educated about the disease and take an active role. I think there are many things, right, affecting their engagement, the minority and underrepresented disadvantaged patients, their engagement. And most of this study could be because they have no access to, right, large centers where such an opportunity exists. So that could be because they may not have insurances, may not have, right, the means to have the right transport to get there, right?
Yeah.
The cultural biases, like when you mention about clinical trials, right? Some patients do actually think that it's an, quote unquote, an experiment. So it's our job to take our time and educate them about what it means. It needs a huge effort on the frontline providers. I had many patients that stated that, quote unquote, they don't want to be, part of an experiment. But after sitting down, breaking it down, they have no concern about being part of a clinical trial.
Because some of that's historical as well, isn't it?
Definitely. So we have to work hard, right, to break those barriers.
And how do you do community outreach in those areas?
I think that's a multi-level engagement. We, the PSC community and providers, have to educate primary cares, not alone just GI, right? Going back to the primary care providers about what PSC is, how it presents, that to keep it, know when to refer patients to GI or hepatology. So that should start there. And because we're seeing patients, right, after they make it through the steps to get to a liver center, right? So primary care, GI, and then liver. So we have to educate the earlier providers to make sure that they are pushing them along to get to where they need to get to. Once patients are in our system, you have to identify, right, who needs more support and more care. That's the equity part, right? The DEI part of the DEI effort is promoting equity so that we can achieve an optimal health to all. So we, for example, an example that I can give you would be the model of like outreach clinic. An outreach clinic, like we have about 18 satellite clinics covering all over Northern California, including rural areas where we will have clinic at a local GIs or primary care clinics where you take your expert care to the communities. That way you are allowing access to people that will not be able to come to see you. Translation, right? You need to make sure that you take your time to have a translator on video or on phone or in person. I have one provider who's a gastroenterologist. She amazes me. Her patient has a very complicated autoimmune disease, and she will not, she can't drive, and so in her office made an effort to have some type of voucher for Uber or Lyft so that she can come to clinic. And then the other piece, most of all, is educating our patients and highlight what's available to them. Like PSC Partners is such a great resource with the peer groups and mentorship. And we also have our own California Pacific Medical Center autoimmune support group where we have mentorship where we compare one patient to another so that they can support them one-to-one. And having a conversation with someone alike is what I hear from my patients that are minority often in connecting them. I always inquire, who's your caregiver, bring someone with you. It's nice you really have to be in tune of those needs and really invest the time to support them because you have to do something extra. That's the equity. Not everyone may need the same effort, but make sure that we all take our time to support the patients and need more.
So there's also some education on the physicians, I think, as well. I also didn't ask you about your study.
So that's a consortium. So the lead investigator was Dr. David Goldberg. It was sampling a cross-sectional data from centers that are part of the North America Autoimmune Liver Disease Consortium. It's also called CALID, which is led by Dr. Chris Bolles. And so Dr. Goldberg sampled the PSC, total PSC patient and the racial breakdown among 13 centers that included Henry Ford, Columbia, Yale, University of Miami, California Pacific Medical Center, which is our center, University of Pennsylvania, University of Colorado, University of Washington, Mass General, Johns Hopkins, Baylor, University of Calgary, that's North America, Canada, and UC Davis. So it's a wide spectrum of large liver centers all across North America. So Dr. Goldberg showed that the proportion of African American compared to the overall patient population per center, it ranged from, like I said, 25% at Henry Ford down to 0.7% of the patient population in Calgary. For example, we had about 5% of our patients who had African American at that time. I have a bit more now. And then he compared it with the national census data for the particular area. And it seems to be, to the most part, the proportion of Black PSC patients seems to be proportional to the proportion of Blacks in that particular city. So what does it mean? It means that PSC does affect Blacks, and it seems to be proportional, to the most part, to the proportion of Blacks in that area. There are limited study, by the way, Nayel, about understanding the outcomes and how our minorities with PSC or autoimmune liver disease are affected. How is it affecting them differently and why? So there are limited data. For example, one study showed that African Americans with autoimmune liver diseases were more likely to be removed from a wait list for, after being listed for death or clinical deterioration, right? Why are African Americans dropping, not making it to transplant? So we need to know why. And another study, but interestingly, this particular study was looking at autoimmune liver diseases in general. But once they were transplanted, compared to Caucasians, they actually had the same outcome. So getting to transplant and then maintaining them, making them get to transplant is important. Why are they dropping for getting sicker or dying? While another study looked at PSC, right, outcomes of minority patients with PSC. So they looked at 4,046 patients that were listed for PSC in the US, right, from year 2005 to year 2017. So compared to non-Hispanic whites, the Hispanics had significantly lower probability of receiving liver transplant after being listed. And it was about 20%, 27% lower than the non-Hispanic whites.
Wow.
After they made it to the list, right? What's happening there? And the same study showed that African Americans had a significantly higher risk of dying after liver transplant compared to non-Hispanic whites. Remember, the prior paper did not show a difference in that was taking all autoimmune liver diseases in an account. This is particularly to PSC. And one thing which is also intriguing, this paper was published in 2021 in Journal of Clinical Hepatology. So in comparison to the US Census data, for example, at that point, about 18.5% of the US population was Hispanic, right? The proportion of Hispanics that were actually listed for liver transplant was only 4%.
Wow.
There's a big gap. So these are just like this is it really in terms of the available data, Niall. So we really have to do more research to understand the impact, right, to begin with, and figuring out the barriers was really accounting is a big undertaking. It needs a multi-stake involvement, understanding the barriers, and more importantly to me personally, and I think we should all think about that, is not just reporting, right? We all report about how minority and disadvantaged patients have poor outcome and cancer or now in autoimmune diseases, even based on the limited data. But I haven't seen any studies that actually looked at even the known barriers, right? Implementing changes in how that is improving care. I think we need to focus on the solution. Who is disadvantaged? That really includes racial and ethnic minority groups, individuals with low socioeconomic status, individuals with disability, people living in rural area. We have patients that actually live in remote. It's difficult to get their scans on time, blood work on time, trying to make it to the city to get ERCP when needed. So rural area, immigrants, the cancer data also shows us the LGBT community is also affected a bit more. And, elderly, because really need to take your time and support, and they need more support. If we're not doing that, they also could be discriminated.
Is there anything that we haven't talked about that we should talk about?
It is important in terms of PSC. PSC Partners has formed a diversity, inclusion, and equity task force, working group. And I'm part of that. And, I'm happy to have the opportunity to work with them to promote, improved care for patients with PSC. We have an upcoming webinar on, and we have invited multiple stakeholders, patients, caregivers, researchers, clinicians and researchers, pharmaceutical companies that are doing clinical trials in PSC, and also PSC partners to have an open conversation about not just what has happened to our underrepresented patients, but what are some of the things that we want to work on as a team, like new solutions. There's a lot to be done, a lot to understand, but we all have to take our part. And PSC Partners is also creating a peer, it's one of their Zoom platforms, peer platforms, and it's called Celebrating Diversity in PSC. So I want to make sure that we're letting people know to be part of that platform so that they can come in and give feedbacks or voice and support each other. That would be a peer support group for patients and caregivers. It would be immensely meeting they are planning on organizing. So there are more things to come. I think we all should do our part, understanding it, supporting our patients and contribute to the solution of improved health care for all patients with PSC.
Well, wonderful. I look forward to that. Well, Dr. Kidist, Yimam, thank you very much for your time and for your service in the community as well.
Thank you so much, Niall.
Well, I'm afraid that's all the time we have for this week. For more information about PSC and for a list of people and topics we'll be covering in the near future, please go to www.pscpartners.org. That's www.pscpartners.org. PSC Partners is a non-profit organisation dedicated to providing education and support to primary sclerosing cholangitis patients. There is information and resources on the website. There is a conference once a year. There is a private Facebook group that you can also join. Also, please join our patient registry. This is an anonymous database that provides research support to the medical community who are researching this disease. Thank you very much for listening.